if proves it cannot.
Good morning, Dr. Hughes.
Good morning, Mr. Dennison.
The last time you were here, I believed that you testified that you had diagnosed Ms. Hurd with PTSD before you gave the gold standard CAPS-5 test.
That's correct.
Right.
So before she gave the test, she diagnosed
diagnosis is actually reflected in the first of the disclosures you put forward in this case.
I believe the first disclosure was February 2021. And at that point, I had done
Jim, you're right.
11 psychological tests. That's correct.
Right. And your disclosure reads, Ms. Hurd's responses on the PCL-5 support a DSM-5 diagnosis of post-traumatic stress disorder with an etiology of intimate partner violence she experienced by a former partner. Remember writing that?
That's correct.
Okay. You just testified that you need to read the manual, right?
Yes.
Oh, is he going to hit her with the manual?
Can we put up 1311 as a demonstrative?
What the hell happened to Dennison? He all of a sudden became like the god of cross-examination. Yes, he said read the manual. Don't tell me you're going to impeach her with the manual. Don't tell me you're going to impeach her with the manual. Are we going to impeach her with the manual? If he does this, people, this is going to be crazy. Let me see.
Any objection to
I don't know
1311?
what it is, Your Honor.
All right, if you want to
Maybe
lay
we approach.
approach.
Tommy.
So I'm expecting. So let's see if I can predict what's going to happen. I don't know. I don't know what he's going to say, but I'm predicting that the manual is going to say she was supposed to give the test first before diagnosing or something like that. And that's why when she said, I don't believe Curry read the manual, he said, oh, read the manual, right? Let's go to the manual. So I think this is going to be, you're talking about she needs to read the manual. You need to read the manual. That's where I think this is going, but I don't know. So let's see if my prediction is right. They're coming back. Oh my God. She's going to be, if he turned to, let's see it, John. Let's see it. Here we go. Here we go.
Thank you.
Shut up. Giving her the manual. Okay. Where are we going with this? It better be good, Dennison. You got me talking it up. That's what I would do.
Don't see this in my document.
They're getting the right one up.
Yeah, we got it.
Elaine's like, I don't see
Let's
it.
use 1312.
1312. Okay.
Plaintiff 1312.
And that, any objection to that demonstrative?
No, Your Honor.
Okay, 1312 can be
So it's
published.
not
in
going to the
jury.
jury. It's just going
Dr. Hughes, do you recognize what the National Center for PTSD is?
What it is?
Yeah.
Yes, I do.
And they publish the PTSD checklist for DSM-5,
That's correct.
that what we've been calling the PCL-5.
Correct.
All right.
Come on, Dennison. Let's see what
And
you're doing.
are you familiar with the document that's on your screen?
Yes.
She's got to be, right? She's the
What is it?
expert of experts.
It's the instruction manual to how to administer the PCL-5.
Okay.
Your experiences.
I'd like to move for the admission of 1312.
Any objection to 1312 coming in?
I don't know.
evidence?
George
All right,
is just too-
1312 and evidence.
George's too wild. George
Can
is
we go to the
just too
second
wild.
page?
You just don't know. All right, here we go. The impeachment. But this is a good question.
Can we blow up the second paragraph on the right?
Is he going to have her read it? That'd be gangster. Have her read it.
The PCL-5 should not be used as a standalone diagnostic tool. When considering a diagnosis, the clinician will still need to use clinical interviewing skills and a recommended structured interview, e.g., the CAPS-5, to determine a diagnosis. Correct? That's what the manual says.
Right, and this manual
Okay.
also
That's what the
says
manual
that
says.
This is a screening instrument, so
That's
when
what
you
the
do the
manual
clinical
says.
interviewing, you absolutely can determine
So
diagnosis.
So the
after
answer is
somebody
yes. The manual says you
Still
the
need to
Cut her
use
off.
clinical
Cut her off.
interviewing
Cut
skills,
her off.
which I used.
The manual
Let
says
me
yes.
finish my question. The PCL-5 should not be used as a standalone diagnostic tool, and they recommend using the CAPS-5 to determine a diagnosis, correct?
Doctor.
It does say that, yes.
Yeah, and you made your diagnosis before you did the CAPS.
I made my
Yes.
diagnosis doing clinical interviewing and
Yes.
11 other
Yes.
psychological tests that
Yes.
supported diagnosis
Yes.
of PTSD and symptomatology consistent
Doc.
with PTSD.
Doc.
Okay.
Doc. You fighting, Doc.
You said that we should read the manual. Would you also agree with me that we need to read the directions on these tests?
Are we going to the
Sure.
directions?
Okay.
Dennison's read the manual.
Tom, can you pull up 1309 as a demonstrative?
Ah, he's killing her with the manual. This is brutal. This is brutal. You said you got to follow the manual. All right, you didn't follow it this time. Let's go to the directions.
Yes. Thank you.
Dennison's like, yo, let's go. You didn't follow this one. Let's go to the directions. My God.
Any objection of 1309 as a demonstrative?
May we approach?
Okay.
Elena's like, we got to stop this massacre. It's a massacre. Dennison is doing pretty good today. Dennison, you stepped up your game. I gotta say, Dennison's he came prepared this morning. It's like, oh, I get Dr. Curry again. You see, that's why you got to be careful what you said. That's what you said. She should have read the manual. Here's the manual. Seems like you didn't read it either. Tough. And she's already not likable.
The jury is demonstrative.
This is devastating. Yeah. John, you're right. This is devastating.
Doctor, do you recognize the demonstrative that's in front of you?
It wasn't.
Yes, but I didn't put the red lines on that.
Okay.
No, I didn't.
Yes, I know.
Okay. So this, what do you recognize this as?
I recognize that we previously discussed this, and I told you that I oriented Ms. Hurd to a different time frame because she was already out of the relationship.
You
Okay,
ask the question.
maybe we should back it up a little.
Yes,
This
ask
is
the
the
question.
CTS-2 that you administered as part of this battery of tests that you indicate you did in relationship to your diagnosis.
Right, this is the conflict tactic scale too.
See, he's got to
And
control it a
you'll
little
agree with me that this test specifically asks, in front of every single question, how often did this happen in the past year?
I am paying back those lines.
Correct, and I
Right.
oriented
And
the
you
individual
know-
to not
and
limit
it's
herself to the
correct.
last year to get an
No,
accurate
you
assessment
gotta control
of
it.
the
I guess
violence
it
and
did-
abuse
I
that she
am
experienced
asking
in
the
the
question.
relationship.
Objection, Your Honor, move to strike.
All right. I'll move to strike the last part of the answer. Strike the last part of the answer. Thank you. Next question.
Yeah, and you know that at the
Shut up,
time
doctor.
that you gave this test to Ms. Hurd, she had been away from Mr. Depp for far longer than a year, correct?
Which is why I
Correct.
oriented her to a
Correct.
different
Yes or no,
time
ma'am?
frame in answering the
Correct.
Doctor,
question.
yes or
Correct.
no?
So of course,
There it
Okay,
is.
you knew she was gone for more than a year.
of
He's
course.
controlling it
All
now.
right. Let's look at another one of these.
Not following directions, doctor. Got an expert are you? The directions on the form she filled out.
You
tough
talked
nut,
about the danger assessment test.
That's correct.
He went through the test. This witness is a disaster now. This witness went on about talking about following directions and now turned into a damn disaster on the stand.
What number is this?
Unforced error.
13,
Danger of
plaintiff's
bringing people
13,
back.
10.
Yeah. Now Dennison has everything he
Thank
needs to burn these folks.
Any
Yeah.
objection to 1310?
And you know he's
as
probably been
demonstrative?
watching all the thing. Oh,
Okay.
Dennison could have did a better
publish
job.
the jury.
She won. So you know he was like, please God, let me get a second crack. And you know
Dr.
she's all
Hughes,
upset.
this is a blank form, but this is the danger assessment test that you also gave to Ms. Hurd, correct?
I didn't give it to her. I filled it out based on the data that was provided to me.
Oh, so you asked her the questions and then you filled it in.
It was somewhat collaborative.
Okay. Can we blow up the second full paragraph?
Take a full paragraph. What's it say?
It says, using the calendar, please mark the approximate dates during the past year when you were abused by your partner or ex-partner. You didn't use any calendar, did you?
I did
Yes
not
or no?
use a calendar
All
because
right,
she
that's
was
it. That's
already
my
out of the
question. That's my
relationship. As I
question.
said,
That's
these
my
are
question.
static risk factors, so they don't change.
That's my
So I
question.
oriented
Control the
the
witness.
time of
Control the witness.
relationship.
Control
Ma'am,
the
it's fair to
witness.
say that this examination that you gave specifically indicates that that you were supposed to look over the past year. And
That's
not the
one,
language?
no, that's one administration. People use this instrument for if you're in an acute situation in a relationship, trying to get a better assessment of the current behaviors. We can use it retrospectively, like I just stated, and in homicides and looking back about what are the serious risk factors that were in this relationship.
I didn't ask you about anything other than, don't the instructions limit this test to the previous year?
Yes or no?
You can give this
Yes.
test not only on the
Nope,
previous
asking
year,
you about the instructions.
but I'm
Yes
telling
or
you
no?
how the
I'm
test is
asking, I don't
administered
care.
in
I don't
clinical
care. I'm
practice
asking
and
you
in
about the
forensic
instructions.
practice.
And opposing counsel can come up and ask questions about it. I'm asking you about the instructions. And the instructions say,
Controller.
look over the past year.
Correct?
Yeah, on this, yes,
Yes.
that it says that.
Yes.
And you had actual knowledge when you gave the test that Mr. Depp was gone way more than a year before this test.
Yes.
That is correct.
Right.
You see that? Yes, that
Let's
is
look
correct.
at more
Shut her up.
instructions.
More instructions. Oh
Can we
my
look at
God.
1247, which is
Dennison
already in
has
evidence.
got the gut out. He's like, we're gonna go through them all, baby, to show you what you that you want to talk about instructions. We're gonna go over some instructions. He is on fire. Go, Dennison.
Dr. Hughes,
Good
you
job.
recognize this one too, right?
Yes,
All right. This is
Want to see a dead body?
what everybody calls the
Oh,
CAPS
he's-
5.
correct.
He's on the way of
Can we go
killing
to the
it
first page?
because he's killing it. More instructions. We
Let's
read
blow
more
up the
instructions about the DSM-5 than ever. Here we go. Let me be quiet so we can hear it.
Standard administration and scoring of the CAPS 5 are essential for producing reliable and valid scores and diagnostic decisions. Correct?
Correct.
And you have to do this in a standardized way because it is the first instruction, correct?
Correct.
Can we go to the next page? One more. Oh, wait, that's good. This is a page on scoring, and we talked about this last time.
Yes.
You score these tests by frequency and intensity.
Correct.
And you'll remember that in every single instance that you were asked to fill in the blank about frequency, you failed to do so, correct?
That's not correct.
Oh, you filled in any blank on this form with respect to frequency?
I filled in the frequency on the side of the caps where I am actually scoring the caps.
No, I asked
Where
you
it's
whether
relevant.
you filled in a single blank on this form with respect to frequency. Is the answer to that yes or no?
I don't know what you mean, a single blank.
All right, let's
Pull up the blank.
let's keep going. All right, we'll stay at this page for a second. This is the very first box you're asked to fill in as to, I think, a fairly
walking into the
fundamental
gallows,
question, right?
yeah.
What happened?
We talked about this before, Mr. Dennison.
Yep.
I had 88 pages of notes of what happened.
Now it's
It would have been
excuses now.
redundant to put it there.
It's
You know that you are obligated to produce this test in a way that other people can meaningfully review them. Yes?
The people in this case
all
who
I'm
are
asking.
meaningfully
That's not what I'm
reviewing them
asking.
have
That's
my
all I'm
88
asking.
pages of
I'm not
notes.
asking you that.
But you chose to put absolutely nothing in the box, the standardized box that said what happened.
You don't have to put it in the box if you have it somewhere else.
You just
It's
tell me.
not
Because
a,
this
if
is
it's
not
not
a
a,
standardized test.
well, if it's not a research instrument that is used for research, if you're using it for a clinical diagnostic purpose, no, you don't. If you have that data elsewhere.
Okay, let's go another page or so.
Thanks for the 9. Thanks, Ed.
All right. Let's go another one.
Dennison busted out the manual. This figuratively.
All right, let's look at item
over the head with it.
4B4.
Follow the directions. Thanks for the $10 there, Scully. Yeah.
And I asked you, and you filled in the blank about frequency. And there's a blank in many of these items that asks number of times. You didn't fill a single one of them in, did you?
Right, because I filled them on the right side of the instrument where I am scoring
She
it.
is not. filled
And
it
that
in.
is the way that you believe that you followed the instructions of a standardized test.
Yes, correct.
No further questions.